health correspondent Nicola Hill, who joins us from London. Nicola, this doesn't surprise me because so many people I speak to have said they haven't slept well during the height of the pandemic. So even myself sometimes, not insomnia, but definitely sleeplessness. What more can you tell us about these studies?
Yeah, I agree with you, Maria. I mean, to be perfectly honest, when I first saw the research, I was a little bit like, well, that doesn't surprise me either, because most of, my colleagues and my friends here in London have been saying exactly the same thing. But this actually was the first proper research that's been done into sleeplessness during the pandemic. It's been done by an organisation called Understanding Society COVID-19. It's set up by various universities here in the UK. And it looked at more than 15,000 people, and they were questioned both before and after lockdown started with the pandemic to find out exactly what the fear of the disease and the lockdown is actually doing to their sleep. And the figures are quite striking, perhaps not surprising, as you said. So they found out that it used to be 1 in 6 apparently initially complained about having sleeplessness at times. That's gone to 1 in 4 people. And certain groups, as you detailed there, are much more afflicted by this. So some of the figures that they had, for men beforehand, the figures of sleeplessness were 16% and now they're 19%. But for women, there's been a much greater jump. So some of the figures that they had, they went from 19% to 32% of women saying that they were now suffering from sleeplessness. And Professor Jane Franklingham, who's the woman who's actually been leading this research, says it's because of its fear of your health, its fear of what's happening to your jobs, what's happening to your family, to your friends. It's the disruption to the routine. All of these lead to anxiety. Anxiety leads to stress. And of course, stress is leading to this sleeplessness. So picking out some of these statistics that their study has come up with in addition, the group who are really badly affected from women are mothers. And 40% of women with young children reported sleeplessness. And this isn't just because they're disturbed by crying babies. This is because they are juggling so much. And the figures of women with school-age children who complained about sleeplessness was 38%, so not that much difference. And what Professor Franklingham is saying is it's because they're juggling childcare, they're juggling their working from home, that transition to working from home, and homeschooling. And often it might also be elderly parents having to deal with their problems, perhaps having to, if they're socially isolating, having to sort out food deliveries for them. I know it's certainly something that I was trying to do at one point for my mum. And it's issues like this that they think is really causing the problem for women. The other groups that were badly affected were key workers working in health and social care, education. Again, it might not be surprising because they're the frontline workers. But then also people from Black, Asian and minority ethnic communities. And they too, the figures involving them were also much higher. They said 9.4% of BAME respondents reported having lost sleep much more than usual through worrying in the first 4 weeks of lockdown, and that compared with only 4.4% of white respondents. So definitely big groups of people who are much more disproportionately affected by sleep loss and worry, and again, the consequences of what this pandemic is doing.
Nicola, very briefly, the coronavirus hasn't gone away, so what can be done to solve sleeplessness and insomnia?
Well, Professor Franklingham says what needs to be done is policymakers need to provide more support for the vulnerable, because she says if this is not done, there will be secondary health issues. I mean, you and I have talked before about the mental health issues of many people during this pandemic. So she says policymakers have to do this, whether this is more sleep clinics, whether this is more apps, there's various apps that are available nowadays, or just encouraging people, in addition to exercising, to also do mindfulness training, perhaps yoga, things like that.
Nicola Hill, thank you very much indeed for this update on sleeplessness and insomnia and coronavirus.